Welcome to the IEA's YouTube channel. Don't forget to hit the subscribe button below. My name is Kristian Niemietz and I am the head of political economy here at the IEA. I'm joined today by Dr Nima Sanandaji, the president of the European Centre for Entrepreneurship and Policy Reform. Many of you will be familiar with some of Nima's work. He is the author of our book, Scandinavian Unexceptionalism, in which he dispels some of the myths about Nordic social democracy, which are popular in the Anglosphere. But today we're going to talk about something completely different, which is Nima's new book, released today, which is called The Henry Fords of Healthcare. It's a book about entrepreneurship in the healthcare sector and its effects. Nima, thank you for joining me.
Thank you for having me.
Sure. Why don't you start by telling us a little bit about the book? Who are those Henry Fords of healthcare, and why did you decide to write a book about them?
Well, for many years, I've been writing policy studies and a couple of books on healthcare, primarily on the Swedish experience of healthcare and the challenges in the Swedish welfare state to provide healthcare. And the obvious thing that comes up is that healthcare and elderly care are gradually not working in the Western context. Year for year, we see that the economy is becoming more efficient, but healthcare provision and also elderly care provision isn't. So while the economies of countries like Sweden are growing, each year they are struggling to pay for healthcare. And even the healthcare that used to be paid for, even the healthcare that isn't more technologically advanced, but even the healthcare that people used to get before, somehow is getting more expensive to get, or at least there isn't any positive growth. And okay, so in policy terms, you start looking for what countries do have good healthcare. And there are some European countries that have a good healthcare model, but basically in the Western world, healthcare has problems. The US doesn't have a good healthcare system. The UK doesn't have a good healthcare system. Sweden doesn't have a good healthcare system. It's not I mean, the welfare states of the Western world, anything from the small welfare state of the United States to the big welfare state of Sweden, have problems with healthcare delivery. And one thing I've stumbled on is that really the efficient healthcare delivery actually exists in places like India, in Thailand, a bit in Singapore, China, United Arab Emirates. And these countries have a number of health entrepreneurs who, very much like Henry Ford, have streamlined healthcare delivery and have reached a position where millions of people are given advanced healthcare in heart surgery, cancer treatment, and are getting high quality treatment at very low costs. And there's a massive health tourism where millions of Americans, British, Swedes, you name it, are traveling to places like Thailand and India and Singapore and South Korea and etc. to get high quality healthcare. And so the base, and then what's happened? What is it that's happened? It's not only cheap labor. To a large degree, the very, very basic ideas of streamlined procedures that have been around for more than 100 years in Western capitalism are actually put to use in these Eastern countries when producing healthcare. And so the book is about how really the Western countries are stuck in inefficient healthcare delivery, and how the systems are not open to the very obvious innovations of creating streamlined healthcare, and how people like David Chetty in India have accomplished this. And this is quite well documented now that not only are they treating millions of people with costs that are just not comparable to the Western countries, but that they're also developing, they're offering high quality healthcare, and they're even, they've built entire health cities, and they're conducting research in improving heart surgery and eye surgery, etc. So now, actually, paradoxically, the West has to learn from the East. And for me, it's not a paradox, because healthcare historically very much developed in countries like, Middle East, India, and traditionally the healthcare development of these countries has been very much open for free markets. healthcare has been run as a business for a long time in these institutional settings. So it's actually the Europeans and the Americans who've not managed to create good systems. So in this instance, we have to look for the East to see the free market at work in healthcare. And I think Western countries have to adopt systems that allow for real entrepreneurship in healthcare.
Okay, but just to be clear on this, your argument is not that we should adopt the healthcare system of India or the healthcare system of a Middle Eastern country. You're looking at specific case studies of successful entrepreneurship, and you're saying this is what we should learn from.
Yes, and these specific entrepreneurs largely are found in countries like India and mostly India, Thailand, Singapore, because their innovations are very, very simple. So like one of them is David Chetty, who is, this guy is an Indian heart surgeon, and he was a personal physician of Mother Teresa. He's a good heart surgeon. So he started looking at, okay, how do we make heart surgery affordable for Indians? And all his career, he's worked towards that. And in 2001, he sets up a hospital, and this hospital he sets it up to really streamline heart surgery. So basically, patients come in a room, they wait, they go in a room, you know, they're prepared for surgery. Then they go to a surgery room, they're operated, then they go out. And each room is just designed for its task. They design the hospital for the task. And in the room, they set up, okay, here we have this equipment, here we have this equipment. They outline it and put it on the wall. If you think about it, it's very much like if you go to a fast food place, they've designed the restaurant, right, to provide service. If you go to a factory, they've designed the factory to provide a certain work. They have workstations. And these people who are working at the hospital, like the heart surgeon, they're just doing heart surgery. They're not shifting between different tasks, paperwork, a different kind of surgery. The nurses similarly are working with the same treatments every day. So what do you have? Very efficient heart surgery. David Chetty himself has performed, if you look at Wikipedia, for example, 15,000 heart surgeries himself. And the hospitals have treated millions of people. And the numerous studies, Harvard Business Review, Wall Street Journal, case studies, which show that not only are David Chetty and similar health entrepreneurs offering extremely low cost heart surgery and eye surgery and cancer treatments, but they're actually doing it at very high qualities because they have good physicians, good nurses, and if you work with something every day, you become good at it. And if you design a healthcare system to just provide cancer treatment, just provide eye surgery, you can gain a significant level of productivity. Another example is Aravind Eye Clinic, which is, this is more charitable, while David Chetty is just purely capitalist. But Aravind Eye Clinic, that's set up in eye treatment. And they managed to give millions of people eye surgery, some of them for free. And they didn't do it with charitable givings, but they charged their clients a low fee. But because their costs were so low, they could actually give a lot of the patients free healthcare. And they even produced the eye lenses at place. So you look at this and you say, okay, one of the reasons is India has a big population, so they can build up these super specialized hospitals and entire health cities with just a bunch of different specialized hospitals working together. But ultimately, that's not the main difference. The main difference is healthcare is so much regulated in the Western context. How to deliver healthcare is regulated, but a lot of the, not only that, you should have a doctor, you should have the good equipment, but there are so many other layers of regulation. And there are so many levels of regulation associated with getting paid to carry out medical treatments. So in effect, the Western regulators and the Western welfare states and in the US, the system with lawyers suing every doctor, have created a system where healthcare cannot be innovative. Where, I mean, you look at healthcare, you see it's expensive, you see that's very difficult for people to access it, right? This problem is across the Western world. Obviously, you should just set up a system where people go, meet the doctor, they're treated, they go home. But Western countries have not been able to reach this, while the Henry Fords of healthcare have. And I think the reason is not that Westerners don't understand the concepts of producing services efficiently, because throughout the economy, services are produced efficiently, but because the regulation doesn't allow this. So healthcare has become over-regulated, and year after year, it becomes less productive in comparison to the other parts of the economy. And people have given up. It's like in the West, people almost have given up and say, okay, we can't have efficient healthcare. You know, there is very little discussion about why can't we have efficient healthcare? If the rest of society is efficient, why can't healthcare be efficient? Well, the Henry Fords of healthcare show it can be efficient. And one of the interesting things is, in the case studies, you see that the inspiration for these entrepreneurs have been Henry Ford, or in Aravind Eye Clinic, McDonald's. So the very basic concepts of standardized service delivery, of setting up a workstation and for the task it's supposed to be, of specializing people and doing one task again and again, it works in healthcare, just not in the Western context, because Western regulators do not allow it, and Western welfare states in particular.
Yes, the conventional argument here among health economists is that this is a manifestation of Baumol's cost disease. It's just an inherently labor-intensive industry, and therefore you can't have the productivity improvements that we see in, say, mobile technology or computers. You are not convinced by that, I take it.
Well, I mean, it doesn't make sense, because a large part of the economy, I mean, it makes sense that we are seeing Baumol's cost disease, but it doesn't make sense that you can't have healthcare run efficiently, because a large segment of our economy is what? It's services, right?
Right.
The big share of economic growth is services. And
but we still find ways around them.
Well, and also automation. There's a lot of automation in healthcare. There are health robots. There are increasingly robotized surgery, etc. And you don't need that, by the way. You just need to set up efficient healthcare. I mean, go to a hospital yourself. Doesn't matter if you do it in Sweden or UK or US. Usually, I mean, sometimes it's a very good experience, but usually you see inefficiencies in the hospital design. You know, the patient goes to one room, waits there an hour, goes to a second room, etc. So just the workflow from the patient side and from the doctor's side isn't efficient. I mean, right? So that's the important part. Setting up hospitals that are linked to the task. There is an interesting comparison that I read, which is very interesting, is looking at shaving yourself. So in shaving, you have Gillette, which invented a modern razor. And at first they had one blade, then they have 2 blades and 3 blades and 4 blades. And they keep adding more blades, and they're making the blades more and more advanced steel. So the shaving experience becomes better, right? But this is a quality increasing, cost increasing innovation. And this is what we're seeing in Western healthcare. For example, cancer treatments, more and more cancers are treated, but of course the cost goes up because it's more and more advanced techniques. But then if you look at shaving, you had the electric, electric system for shaving your face. Now that's a radical innovation, because nowadays, of course, you can choose both systems. But when at first the electric shaving machine came, that was a new system, right? And being a new system, it wasn't as smooth shaving as you would get with the shaving with the razor. So why did people adopt for them shaving their, buying an electronic device to shave themselves? Cost. It costs less. You don't have to replace the razors as much. And then with time, the new technology improves, And then you have, many people are shaving themselves with an electronic machine now. So this is the important thing of shifting towards the innovation, which is just about increasing the quality of something delivered, shaving or healthcare, also to be able to move towards a radical innovation, which is cost saving. And often case, the radical innovations can also be quality enhancing. And this is what the Henry Fords of healthcare have been able to do. Set up very, very basic idea of specialized hospitals where the rooms are set up for special forms of treatments, where the doctors and nurses are doing the same tasks every day and becoming specialized in providing heart surgery, cancer treatment, eye surgery. And then what you see is very low costs, very high quality. And really the question one has to ask, why can't the Western countries adapt this? And then, of course, the answer is that healthcare is extremely regulated. There are few parts of the economy which have more regulation than here. And essentially, if you're providing healthcare, even if you're providing healthcare as a private company, you're more or less locked in system where you have to deliver the healthcare like everybody else is delivering it. The opportunity to introduce basic work organizational innovations isn't there. And it's so interesting that I think the Henry Fords of healthcare, these entrepreneurs who have succeeded in doing this in India and Thailand and China and Singapore, etc., they're real inspiration because they show that efficient healthcare delivery has always been a possibility. And I think that is so interesting to try and shift the system in Western countries, because the debate has been going on for decades and it's leading nowhere. It's just an academic debate. Nobody really believes that healthcare can be delivered efficiently. Well, it is being delivered efficiently to tens of millions of people, just in countries that we don't usually see as inspirations. And it's I think the only real possibility of creating a major shift is to send regulators on a travel to see the efficient healthcare provisions of countries like Thailand and India in these very rapidly expanding health chains, and see, okay, why can't healthcare be provided on a rational basis also in UK or Sweden or US?
Isn't the issue also on the demand side rather than just the regulators? Because what the case studies that you talk about in the book all have in common is that these are all cases where necessity was the mother of invention, right? These are places where the public healthcare system is defective, doesn't have the capacity, and the conventional private system is too expensive for a lot of people. So it's not necessarily that patients in these places are more open-minded or more pro-innovation than we Westerners are. It's just that they had no other choice in these situations. You have a situation where you either give this new low-cost eye hospital a try or you go blind, and that's all there is. And when in a situation where necessity is the mother of invention, well, I'm quite fond of invention, but I'm not so fond of necessity. Could we have innovations of that kind in a setting where we are not faced with such a stark choice?
Well, I mean, one group that does have the choice are the millions of Europeans and Americans, people from rich countries, who travel to places like Thailand to get treatment. I mean, you make a big choice of buying a plane ticket to Thailand, paying out of pocket, instead of going with your health provider in the US or UK. But many people do that because although the systems are heavily subsidized or semi-publicly paid or paid through your insurance, the part that the individual pays is still often higher than what you would pay in Thailand or India. And so people with choice also go to these hospitals. And another thing is that they have high quality, because look at a surgeon in, let's say, I know the Swedish system best. How much of the time is a surgeon carrying out surgeries? Well, some of them not that much, because they're stuck in doing paperwork. They're stuck in doing other treatments other than their specialties, right? And similarly with the nurses, they're doing many, many different kinds of work, some of which are not really what they're supposed to do. While in these streamlined health service provisions that the Henry Fords of healthcare have created, the individual gets specialized in doing one kind of work. And if you have a doctor who's specialized in doing one kind of heart surgery, and you have a nurse specialized in helping with that surgery, well, then that person's productivity level and also quality performance level just increases massively. So really the question is, why haven't Western countries organized healthcare on basic concept of organized and efficient service delivery, on the concepts that made Henry Ford successful, on the concepts that made restaurant chains successful? You put up a workstation, you put up a workroom, and you outline on the wall, okay, here is this tool, here's this tool, here's this tool, and these are the tools we need in this room for this kind of surgery we're doing. And they always make sure that the tools needed are in that room. And because they're not using the operating rooms for different kinds of operations, each room has a specific purpose. If you think about it, the issue isn't why are David Chetty and these guys building these massively successful companies and providing a valuable service and themselves earning a lot of money. The core question is, why aren't the Western countries doing this? Because the innovations that are inspiring the Henry Fords of healthcare are the innovations of Henry Ford, right?
Yeah, I mean, the productivity improvements that you identify, they all sound kind of obvious once you spell them out. I mean, economies of scale, yeah, we've been doing this for well over 100 years. Specialization, same thing. I can see why we haven't come up with this within Western systems because of the reasons that you identify. But once they exist, even if it's far away, why don't we just copy and paste them rather than going for system level health reform? Would it be possible to just, let's say, recreate a highly specialized, highly streamlined hospital of that sort within the NHS or within the Swedish system, even if we don't have a system which could come up with those innovations on its own, but a system that can just nonetheless copy best practice?
No, I think, firstly, I think that if it was possible, it would have been done. It's not like these concepts are very well known in the West, right? In Sweden, for example, Sweden has a very big welfare state. They used to have a public monopoly in healthcare, but since the 90s, they've opened up the market for private health provision. So the welfare state pays, but you can go to a private competing hospital. But then they regulate, first of all, they regulate exactly what the public sector is paying for, right? And they're not paying for performance. They're paying for this kind of service and say, okay, you have to provide it this way, this way, this way, this way. And here's documentation. We want documentation. And doctors in Sweden, in comparison with other OECD countries, are performing, I think, one of the least, if not the least, they're seeing fewest patients a year because the doctors have become bureaucrats, because this is the welfare state works. Gradually, they just add more and more layers of paperwork. And so when the private health companies come in the market, and they've been there for nearly 3 decades, some of them, they have to abide the system, and they have to try and squeeze out some profits within this system by somehow reducing parts of the bureaucracy, for example, by introducing some of these innovations of not having the hospital. This they can do. They can build a hospital in a streamlined way so that, okay, you know how you design the actual hospital fits the purpose. Some of these innovations they can do, and they have done it. I mean, it's intelligent people running hospitals, right? And many of them have experience from other parts of the economy where this streamlined delivery is already being applied. You don't have to travel to Thailand and India to learn the basic principles. But the health regulation there's so many layers of overregulation. So you can't do this. You're stuck in delivering the service as the regulators have decided, as is the norm. Yeah. And then you have year after year after year, inefficient healthcare delivery. And then people just gave up. People have given up on the very basic idea of you can have healthcare working well. And there's an idea of no, healthcare. You can have an opinion about healthcare. Healthcare is about people's health. You don't understand. Look, this doctor has been working 30 years. This is how we do it. So there are very, I think the core issue is that Westerners know very well how efficient delivery of a service looks like. They know well how to organize a factory. They know well how to organize even a vet. If you take your animal to a doctor, some of the veterinary clinics are actually very streamlined because they're not as regulated. And they're treating the animals right. And it doesn't seem to people just obvious, why aren't we having the same streamlined procedures for humans? Because the operations are similar, the techniques are similar. Why is the cost so much different? So
is there a way in which one could make those sort of reforms that you have in mind more politically palatable? Because the good thing about the think tank publication, of course, is you can just describe your ideal system as you think it should be. But speaking from experience, and I don't know the Swedish situation, but definitely in Britain, if you just make the case that we should be more like some of our Western European neighbors who have more market-oriented system. In Britain, that is already considered a super radical position. That is already very far outside of the mainstream. And you're going several steps beyond that now. This would be, at least no politician would go anywhere near anything that you've just described. Is there a way that this can be made a bit more politically acceptable? What could be limited
I think
steps?
the way of making it politically acceptable is sending TV cameras to Thailand and India, etc. And then following up as the case studies with the Harvard Business Review and Wall Street Journal, etc. have done to show that they have good outcomes. Because when I'm saying we should remove the regulations, I'm not saying that we should remove the fact that the guy performing heart surgery should be a highly skilled heart surgeon with, with all the education and the techniques and the equipment should be right. That's not the regulation we should remove. In fact, by creating streamlined health service delivery, the heart surgeon will just do more heart surgery in a professional way, right? It's about all that other crazy levels of nonsensical regulation and also the basis that we lock a system. This is how it should be. This is how it should be delivered. And if you go on, like Sweden, where you can have a private company, but going into the welfare state model, it's like, no, you have to still give exactly this service. And they look at it and say, okay, how can we make it a little more streamlined? And they get like a few percentage profit, basically, right, as a business. But they can't set it up so that the doctor is just doing his work, the nurses are doing their work, and this is like large-scale, efficient delivery, and each room is set up for a particular. I mean, because there are so many levels of bureaucracy, and there are so many levels of in 20 years ago, we built this system of you have to check in this and this after each treatment. And 10 years later, a new government came in place. So we have another system where you have to put in this and this data. And the healthcare delivery system, I mean, the amount of bureaucracy they're generating is just staggering. So, okay, is it so that all this bureaucracy is providing patient safety? No, I mean, it's not. It's just creating confusion. Look at the NHS, look at the various studies looking at mistreatments. There's a lot of mistreatment because it's a very big, confused bureaucratic system. Now, the healthcare workers, for example, during this corona crisis, they're heroes. Throughout the world, the healthcare workers are heroes, but they're working in systems. Maybe the corona crisis will shake up people to understand that Western healthcare ultimately needs massive reform. Sweden, for example, for many has been, oh, this is the best welfare in the world, it's the best healthcare in the world, it's the best elderly care in the world. The sad situation during the corona crisis is that many old people have died in corona without being given healthcare. They didn't give healthcare to everybody. Many old people, they just gave them some medication so they, went calmly into death. That's the reality of it. So obviously the healthcare systems have problems. When the corona came up, many Swedish hospitals, healthcare providers, elderly care providers, for weeks, for months, they didn't have proper masks and even, routines for washing your hands and disinfecting them, etc., and the proper equipment, face protection. Why? Because what does it tell us? These systems are hugely complex in their bureaucratic systems, all of that, but they are extremely inflexible. Because of this, having a lot of regulation, having a lot of control doesn't make a system better. It makes it inflexible. It just puts burden of costs on it. To some degree, the hospital systems are just bureaucratic machines, instead of just being focused on delivering healthcare. And I think that one of the issues here is that this is not necessarily a neoliberal case of saying we should have let's open up for profit. This is a more radical thing of saying, listen, free market capitalism works. It's worked for 4,000 years since the age of Babylon, when the market economy was discovered. Healthcare, many people perceive healthcare as being a Western invention, modern healthcare. I'd say modern healthcare to a large degree evolved 1,000 years ago in places like Persia, Arabia, India, which at the time had a pretty evolved market economic model. I mean, the pharmacies of the Middle East, the hospitals of Baghdad, India, Persia. I mean, historically, clearly this was where the later Europeans adapted much of this knowledge. And the system already was largely private for-profit healthcare, right? So in a way, it's going back to these countries that have succeeded, like India. India has a long history of healthcare provision. While India's economic policies to some level have been socialist, I mean, they had a long period of failed socialism in the last century, they never went in and regulated healthcare as much as the Western countries did. And they never had the money to build up a large, inefficient welfare state around it. And then they got, the nice thing is that then they could really come in and implement a streamlined health service based on the idea of how do we get millions of poor Indians quality heart surgery and quality cancer treatment and quality eye surgery, and they succeeded. And once they succeeded, they really surpassed the West. And this shouldn't be news to people if they follow what's happening, because millions of people are each year traveling to places like India and Thailand to get health provision. Almost nobody is traveling to Sweden, right? So clearly it's not a Swedish welfare state that has the best health system. And the UK, well, some people do travel to the UK to get specialized healthcare. There are some really good specialized healthcare. You have some of the best doctors, you have some of the best universities. But the institutional setup for delivering healthcare just is extremely too much regulated in the Western context. Doesn't matter if you look at the US or Sweden or UK, the same thing goes there. Healthcare should be less regulated in many regards so that you can just set up streamlined procedures. And I think lastly, one of the conceptual ideas that is important is if you want a complex system to work, it doesn't mean you have to have extremely complex regulation. In fact, often having streamlined regulation is better because complex systems need clear rules. And the rules of healthcare should be based on, okay, you're doing a heart surgery. How is this heart surgery supposed to be carried out? How do we make sure that the staff carrying out the heart surgery have the correct education and experience? How do we make sure the equipment is sterilized? That level of regulation is the level of regulation needed. All these other bureaucratic levels are just directing the focus of the health service. And then we have Bowman's cost disease, where each year the health services, the welfare services become slightly more expensive compared to the rest of the economy. And over decades, it's creating a system which is not sustainable. Western countries can't keep going like this. Sweden, UK, many countries cannot keep their current health models because they're just becoming less efficient every year. And over the decades...
Do you think it would be possible to set up such an entrepreneurial sector alongside the more conventional welfare state structure, so that you have the two in parallel? You still have the welfare state system in place for people who are overly cautious, don't want to try anything else, or are worried about the quality, and you allow the innovation to happen alongside it. Because in a sense, we already have that. As you said, some people travel to Thailand for healthcare, some travel to India. Why not bring that here, but leave the rest unchanged? Would that be a way to make it politically possible?
I think that, first of all, let me clarify one thing. This is about how to deliver healthcare. This could even be part of the welfare system. I mean, if you do a system like Sweden, where you can go to a private health hospital and get the public money to go with you, like vouchers for healthcare, definitely can be part of the public. I mean, by the way, in India, some of the patients a lot of them are publicly paid. It's not only for... So this very well matches with public funding of healthcare. Mm-hmm. The problem is that, no, you can't set this up in Europe. You can't. It's too much regulation. I knew a Swedish health entrepreneur, I even went there, who set up a very innovative, very interesting health system for, for healthy life and to extend your life by proactively working healthcare. And I remember how she was quite frustrated that she found it was more difficult to set up than what one would imagine, streamlined system. What we would need is sort of a regulatory free zone, like an experiment shop. They allow like one hospital, maybe in cooperation with David Chetty. I mean, come on, he himself should be brought to London.
Yeah, like a special economic zone just for healthcare.
Yeah, just as a test. Oh, okay. If you want to really go to policy environment, that's what you should do. But the initial step is just bring one of these actors over and say, okay, we'll give you some sort of permit to set up shop. We'll look very closely at the health aspect of what you're doing, right? We look very closely that you're delivering health quality, but we'll otherwise be lenient in how we set up the other sorts of bureaucratic requirements, and will help you to be able to run your operations in line with the legislation. And then the legislators need to look at what legislation do we need, okay? What legislation do we need for healthcare for it to work? And for the very many different statistics to be gathered from it. So I think that what you need is, you need to set up one of these operations and then go back and see what regulations do we actually need here. And then the next step is to replace the current legislations with these levels of legislation. And also an understanding that the regulation of healthcare, the problem is so many levels of it, right? You have the safety levels and the professional requirements, which are obviously should be in place. You have a lot of different regulations to the business of healthcare, which, okay. Then you have so many rules and regulations when it comes to what the public sector is paying for, because they're not paying for results. They're paying for treatments. They're paying for the treatments as specified by the public sector. Then you have all these levels of information gathering, where all this paperwork and often you have to put in the information in different systems, the same information, because one government comes and they create one system of health information, etc. So really, what's needed is to set up an efficient healthcare delivery system and reverse engineer the regulations you need for that system. The problem is largely over-regulation. And the problem is also that somehow people think that this is how healthcare should be. Healthcare is sacred, healthcare is unusual, healthcare is something normal people can't understand. Healthcare doesn't work like everything else in the economy. it needs to be like this. No, it doesn't need to be like this. It's the system.
Yeah, and we can already see that. We can see that in practice. You also show in your book that actually there are examples of entrepreneurship and innovation in healthcare to the extent that we allow it in medical technology, for example. That's something where even an NHS purist who wants zero private sector involvement in the delivery of healthcare would be completely okay with the NHS buying medical equipment, medical implants, medical technology from the private sector. If you go to a hospital, every piece of equipment, machinery that you see there is privately manufactured. In that subsector, we do see innovation. But what is so different about the delivery? Why is it that we are comfortable with for-profit entrepreneurship in making medical equipment and pharmaceuticals, but not in the delivery?
Okay, when it comes to that aspect, that you should have entrepreneurship in healthcare, I think I would just say, first of all, as you say, doesn't make sense. Secondly, if you study healthcare, it's largely, historically has been, a lot of it has been for profit. And then I mean, look at Islamic age, free market healthcare that evolved in Baghdad 1,000 years ago, which was, from all accounts, the most advanced healthcare until that time. It was efficient hospital setup, and then the public sector would come in and pay a bit so that the people who could not afford healthcare could have some sort of early sort of universal healthcare, or at least some people who couldn't afford it could get healthcare. But the basis of it is just that it was private, right? So historically, healthcare has been private. Look at France, which people see as a socialist country. They have a long tradition of having independent private doctors. And this has continued along the, welfare state system. So private healthcare has worked throughout history, and people who say it doesn't work, that doesn't make sense. So I know you have the debate still, but that doesn't make sense. This should be government run only. There is no intellectual case for that. What I point at is that even when the countries like, say, Sweden open up for private actors, doesn't help that much. It's not enough because they're so regulated that they can't introduce radical innovations. It's a game with a razor. Just adding more blades on the razor, that's not the innovation we need. That's a quality innovation.
We get the product innovations, but we don't get the cost-cutting process innovations that happen in almost every other sector.
Yes, we don't get
One problem that I can foresee, though, if you had a lightly regulated healthcare sector that is open to entrepreneurship, if you had one scandal happening, it would be all over the press, and the mainstream interpretation would be, look, this is what happens when you deregulate healthcare. You get these charlatans coming in, ripping people off, and then imagine you had one private hospital chain with elevated death rates, and then all the headlines would be private healthcare kills, the profit motive kills, and there would be demands to roll it all back. How could you insure yourself against something like that happening?
You can't, and then you have thousands of mistreatments happening in the NHS, and it doesn't have the same way. But one more thing, even if you just keep the current system, you don't introduce private, you don't even introduce deregulation. Another thing you could do, for example, UK, specialize the hospitals. This is another thing that's a problem of the politically controlled health system, is that for understandable reasons, you have these NHS hospitals, and the hospitals are supposed to carry out most forms of treatment, right? And it doesn't give them any real opportunity to specialize. They can't have one room set up for this form of heart surgery. I mean, they understand that clearly if you set up a room and always carry out a special kind of heart surgery, always make sure the equipment for that special kind of heart surgery are on the walls, and so always the equipment is at place, is clean, it's just set up for the heart surgery. You just carry them out one after another very efficiently. And patients having travel is a problem sometimes, but if you would be given a higher quality treatment, instead of waiting 6 months, you could wait just 2 weeks. And they told you, you have to travel to another part of the country. Many people would do so, and you could always transport them with special ambulances, or you could make it work. This also doesn't happen because of the politically controlled way of providing healthcare. Each region wants to have a hospital, and each hospital has to carry out every treatment. So that's also one of the fundamental problems in the health system, that specialization doesn't really exist to the level it needs to exist. And why you're not bringing specialization, I don't know what the answer would be if you ask the people. In Sweden, they agree with you. If you tell this to a social democrat health provider, they say, yeah, we understand what you're saying. I don't know what we would say in the UK, but this is also one of the problems. The system does not allow for specialization. And a system that does not allow for specialization is a bad system.
Yeah, it would have to be depoliticized already before you see something like that happening, I guess, because at the way things are at the moment, there have been attempts to close some hospitals in order to create bigger, more specialized, concentrated ones. It's just that that's always a political hot topic. It would not happen in an area which is a marginal seat, for example, because then you would just lose that seat. It would be something that a government doesn't touch. They know that there would be resistance against it. There was even one case where somebody set up a single issue party in an area which was affected by hospital closure. The whole purpose of that political party was to stop the closure of that hospital. It was about nothing else, and you can run for parliament just on that platform. Such is the degree of resistance against that.
But that I do understand. I'm not saying that they should close down small hospitals and set up big ones. I'm saying that if you look at the big hospitals in the UK, why don't they specialize the big hospitals and say, okay, you guys, you do cancer treatment. And so we have like 2 big hospitals focusing on cancer treatment. And the other hospitals, for example, one way of going is say you specialize in different cancer treatments, so that depending on your cancer type, they send you to different big hospitals, right? Or they say that, you do heart surgery, specialization within the big hospitals in relation to each other. Mm-hmm. Because I do understand that people resist when they close down the smaller local hospitals. They're just depriving people in that region from the same health access. But within the existing hospitals, you can have a significant specialization. This would also be good because when you have hospitals which also have academic research and teaching of new doctors happening in them, in those hospitals also then you can have a higher level of specialization. But this either doesn't happen because for some reason, the very basic concept of specialization gives quality and decreases costs, isn't allowed in the system. And I think one way to approach this is just to hammer out, we need specialization, we need streamlined systems. When there's one room for each treatment, that room is just used for that treatment. And nurses, for example, if you have nurses in a hospital environment and every day they're working with, let's say, heart surgery, well, those nurses are learning, right? It's not, the individual is learning more and more advanced techniques and can transition towards helping more and maybe even doing some of the simpler tasks that otherwise doctors would do, because the individual is learning by doing. So there's the core issue is specialization. And the core issue is not having your health workers just being bogged down with paperwork.
Yeah.
And not having the hospital rooms.
What happens if present trends continue and if we don't get anything of that sort? Where do you see the future of Western healthcare? Are we just going to get intense rationing, or are we going to see massive tax hikes and costs continuing to go up? What is the future of healthcare in the absence of reform?
Rationing, like Sweden. More and more in Sweden, frequently you find these articles about somebody has cancer, they go to the health hospital, they tell them it's nothing, or usually they pay them some other explanation. One of my friends in Sweden, actually a Swedish free market thinker, unfortunately died because of this. He had cancer in his face. They told him you're stressed without examining him. Many times they told him you're stressed, you got a big cancer lump. They said it's benign. And of course it was cancer, and several years later, he died.
Was that Johnny Munkhammar?
Yes, this is Johnny Munkhammar.
Okay.
And I mean, I've seen this so many times. It's sad. And it's just insane, right? That they're not testing people. In the corona epidemic, there are many cases where somebody calls an ambulance. It's like, I've been trying to get healthcare. I haven't, I'm dying here. The ambulance says you're not bad enough. Then 2 days later, they call the ambulance and the ambulance takes them and gives them healthcare. But I mean, 2 days later, they're really close to dying and the ambulance just rushes them in and they put in the breathing apparatus and they're pumping them up.
Yeah,
like,
sounds very familiar. We get that here too.
These people have been paying more than half of their income in taxes throughout their lives. They can't get healthcare. What is healthcare? It's not magical. It's not voodoo art. It's a service. Obviously, healthcare costs some money because equipment is expensive. They're health professionals, but it doesn't make sense, does it? If you just think about it, forget the politics of it. Think about it. You're paying so much money in tax. Why can't the public sector deliver healthcare? Well, because it's not an efficient system. And this is not a criticism in any way of nurses or doctors, because they're not creating the system. They're just in it. Yeah, so our issue is actually that we need to understand that it is not so that Western countries are free market capitalists and the rest of the world isn't. And then the Western countries are where we should look for innovation. Usually it is like this, right? If you look at computer games, if you look at many different products, many services, you see that, okay, in the Western countries, they've evolved. But more and more, the entrepreneurs of the world, the radical innovators of the world are coming from Singapore and Thailand and India and China, because to some degrees, first they've more and more adopted free markets now, gone back to the free market roots. But also in some cases as healthcare, they've always had more free market models in these countries. And so they haven't got trapped in the same systems of the West. So learn from them. And I think challenge the idea that healthcare should be super expensive and super difficult. And that, I think the best example I can think of is looking at the veterinary hospital. My experience with those has been very good. I mean, of course, I understand that there's variation there, but also then, because typically if your dog needs surgery, you're just paying it for out of pocket or through your insurance, right? And the cost is high. The cost is high to get your dog an operation. It's gonna be a few thousand pounds, for example. But if you see how much healthcare costs for the same operation for a human, it's usually much, much, much higher cost. While the technique is very similar, it's not necessarily more difficult to, it's not a radically different treatment the human is getting than the dog. It's just that veterinary hospitals don't have this system of extreme amount of regulation, and they're focusing on actually providing the health service. So that's one way of looking at it. Looking at the Henry Fords of healthcare is another way of looking at it. And thirdly, just think to yourself, why are people paying so much of their money in tax? Largely to get healthcare. One of the big reasons we're paying high taxes in the welfare states is if you're sick, you want to get the healthcare. And then the corona crisis comes, or you get cancer, and instead of getting healthcare, you have to wait 6 months, 1 year, and then you go there and treat your cancer, and it's maybe too late. Or you have corona and they don't treat you immediately. So there are definitely problems, and the problem is not with the doctors or nurses. The problem is the institutional setting is wrong. More private forces are definitely needed, but private forces that are allowed to introduce workforce innovations. So they cannot be boggled down with all these layers of regulation and control. removing these layers of regulation and control are very, very difficult. So as I said, I see the solution as reverse engineering it. Bring David Chetty, set up a clinic in London, heart surgery, for example, he's, I guess, best at that. And then give it a special permit and reverse engineer back what levels of regulation do you actually need for the hospital to achieve its goal of providing good healthcare. And then see if that reverse engineering back of what does it give you? Probably gives you a lot of information on how to streamline the very, very bureaucratic systems. So something like that needs to be done, because the level of bureaucracy in healthcare is just so much, and there are so many levels that, in effect, something like this to be done, a free zone and reverse engineering of the regulation models. And the core of it is an understanding that Western countries overall are having the ability to produce efficient healthcare with this system, and nobody really is benefiting.
Well, I mean, I would set up lots of free zones, not just for healthcare, but you've just added another reason to do that. Yeah, we could go on for hours here, but I know you've got another appointment. Nima, thank you very much. This has been a fascinating discussion. And to our listeners, I'm not expecting you to agree with everything you've just heard, but I hope you will agree with me that this is the sort of discussion that we need to have more often in Britain, because we normally don't get that. Healthcare is a bit of an intellectual desert. You normally don't get a debate as such. You just get a virtue signaling competition, people competing with each other who can profess greater love for the NHS. And if you're interested in something beyond that, in alternative approaches, then, well, it's really not a crowded field. It's actually just been the IEA, which has been consistent over the years, making that case. One of the very few organizations doing that. And if you would like to hear more of that, consider making a donation to the IEA. And also, don't forget to subscribe and check out our other content. Otherwise, I hope you've enjoyed it, and thank you all for listening.